Top news headlines from the news desk at the Kittanning paper right now on radio for your neighborhood. AM 1380 and FM 103.7 WTYM Kittanning, Ford City.
Good afternoon, everybody. Thank you for coming. My name is Jason Horton. I'm the Pre-Hospital Care Coordinator of Armstrong County Memorial Hospital in partnership with Allegheny Health Network Pre-Hospital Care Services. It's an honor for me to stand here today to recognize a couple of our local EMS agencies who've been honored this year by the American Heart Association Mission Lifeline Award. These agencies are being recognized for their outstanding care of ST elevation myocardial infarction patients, or STEMI patients. The local EMS professionals train diligently to always be prepared for their next call. Throughout the year, we hold multiple trainings that many staff here at ACMH assist us with, and all the professionals come to on the third Tuesday of every night. Through these trainings and the service-based quality assurance programs, these services have exceeded the standards of STEMI care. An integrated system of care allows for EMS to activate the appropriate teams here at ACMH to be prepared for the patient's arrival. EMS truly brings top-notch care to the field, whether that be in a patient's living room, the wilderness, or even a roadway. Unfortunately, too often, patients do not utilize 911 and our EMS partners when they are suffering a STEMI or a major medical emergency. In 2018, only 50% of the patients having STEMIs arriving at ACMH came via EMS. ACMH Hospital is ready and prepared to receive patient handoffs and continue to deliver the life-saving care of EMS. In preparation for today, I looked over some of the statistics about this award, and it was pretty astounding. Nationally, there's approximately 21,000 ambulance services. Only 610 are receiving these awards nationally, and in Pennsylvania, we have about 1,200 ambulance services, and there's only 75 in the state. I feel it's pretty fortunate that we have 3 of those services in Armstrong County being recognized today. Thank you all for attending again. Now I'd like to introduce ACMH Hospital CEO and President, John Lewis.
Thanks, Jason. I promise to be brief since it's a little toasty and sunny out here, but I cannot miss the opportunity, one, to recognize and thank our EMS folks. It absolutely works because of them. The team in the field, the early identification, the early management, and the work together with our hospital personnel and our emergency department is beyond description. I don't think the community always recognizes the value of early intervention, and as Jason said, early identification and reaching out so that our field staff can get out there, recognize it, and cue us in so that we can very early start to bring the team together in preparation. End of the day, in cardiac disease, time is heart muscle. Today we're able to, because of the cardiac PCI and our great EMS teams, we're able to intervene very, very early and prevent cardiac muscle damage. So the earlier we can get our community to recognize, don't drive yourself, don't call a neighbor to bring you to the hospital, but make first contact, because they begin the process for the early identification and starting our team to bring them together so that we can address it as soon as they hit the door. With minimized door, to lab times, we can absolutely save cardiac tissue. So I cannot thank you enough, and we are absolutely, the hospital and the community is unequivocally dependent on this group of professionals. So on behalf of the hospital and my board of trustees, I thank all of you for your efforts and everything you do each and every day, 24/7. So thank you.
Thank you, John. Next, I'd like to introduce, this is Alexander Kuhn from the American Heart Association.
Great. It's great to be here today. Unfortunately, I think all my statements have been taken by Jason and the president here. But I do want to touch on a couple things. When we started this 6 years ago, and actually 10 years ago when we started working on Mission Lifeline, and really building systems of care. You know, I'd go into a lot of hospitals and the conversation was always about it's door to balloon, door to balloon, door to balloon. And we've seen a great paradigm shift over the last 10 years where care begins now as soon as you guys see, the paramedics or the EMTs see a patient with a heart attack. You know, and to go anywhere in your community, do an ECG on patients, you know, activate the cath lab, you know, get that ECG done in 10 minutes, and then really, again, anywhere in your community within 90 minutes, get that patient, do the ECG, get them to the hospital, through the emergency department, up to the cath lab, and that artery open within 90 minutes. Takes a lot of coordination from a lot of folks. You know, dispatchers, EMS providers, your nurses, your doctors in the emergency room, your cath lab team that sometimes have to come in at all hours of the night to get these patients cath. So, and it takes a lot of commitment and obviously administration's commitment to make that happen also. And so it just doesn't happen in a vacuum. As Jason said, there are about 21,000 agencies in the country. Only 610 are getting the award. You know, that's not a lot. You know, and again, about 1,200 agencies in the state of Pennsylvania, and only 75 of them getting the award. So again, a very elite group. You know, and we continue to work with those other agencies to do that from year to year to year. And so we're really today celebrating lives saved because of the hard work of citizens, Kittanning, if I'm saying that wrong, I'll apologize, and Freeport, and ACMH. You know, this is really making your community healthier and saving lives. And the communities that you serve should be very proud of you, and you should be telling your story about the great work that you do and the system of care that's in place. So we encourage more people to call 911. You know, those folks that aren't calling 911 are missing out on a great opportunity to have a better outcome versus driving themselves or not driving at all. You know, so on behalf of all the staff and volunteers of the American Heart Association, I'm going to do this in 3 waves here. I'd like to present, I'm going to do Freeport first with a Bronze Plus Award. Congratulations on your accomplishment.
Thank you.
Next, we'll do hose company number 6. Shake. There you go.
One more right here.
Yep. And hose company is getting the silver award. Thank you again.
Thank you.
Yep. And finally, citizens with the gold.
I see second hand.
Again, thank you for all your life-saving work here.
Again, thank everybody for attending today. There are some light refreshments. I do want to thank a couple special guests today. Dr. Ramsey Khalil, one of our cardiologists here at Armstrong. Thank you for attending. You don't have to come up.
I don't need to talk anyway, but thank you very much.
I thank our cardiac cath lab staff that's here with us today. Thank you. And finally, all of our staff at ACMH, physicians, nurses, everybody, appreciate everything that everybody does to help EMS every day. So, thank you, guys.
WTYM, Kittanning, Fort City, on the radio at AM 1380 and FM 103.7, and online at WTYMradio.com. Radio, computer, or smartphone. Stay connected to radio for your neighborhood.